Well, TB is coming back in Europe. It's deadly and it's coming back under new forms that, let's be honest, we're not very well equipped to tackle. Can you think of any other disease in Europe that kills 4 people an hour and it is basically airborne, meaning it can be transmitted by air? I can't. Well, the problem is that we haven't invested enough in our health system in Europe, and especially after the breakdown of the former Soviet Union. MDR-TB is a man-made problem and is basically a marker of the failure of investing more in health. One thing is sure is that TB and multi-drug resistant TB is not going to go away by its own. So the European Union needs to take into account that there needs to be investment and there needs to be a concerted effort. We understand that the responsibility for providing healthcare lies at national level, but the EU needs to realize that this is a regional problem, that some countries cannot contain the threat on their own. So a regional political leadership can very well complement the national efforts on the ground. And for instance, the European Commission, together with member states, could organize a high-level summit on domestic financing for TB and HIV with stakeholders, partners, but most importantly with ministers of health and ministers of finance to talk about that problem. It isn't. Yesterday, ECDC published a press release showing that only 1 out of 3 patients in the European Union with drug-resistant TB manages to get cured. Isn't it shocking that nowadays, if you have drug-resistant TB, you have 3 times more chances of getting cured if you live in the Democratic Republic of Congo than if you live in Bulgaria or Romania?